a percutaneous endoscopic gastrostomy procedure, also known as PEG tube placement. It's a mouthful. So the medical team will endoscopically insert a scope into the patient's mouth and will guide it through the digestive system, through the esophagus, into the stomach, which is where the incision will be made through the skin of the patient's abdomen. It's pretty cool to watch. If you're an ICU nurse and your patient needs a G-tube, the GI team will bring their crew to the room and do the procedure at the bedside, which means you need consent, which is a whole nother video. So what is a G-tube? So once a G-tube is in place and you have an order to access the site, you can then safely deliver medications in liquid form, nutrients and fluids safely for the patient that is not able to have anything by mouth, anticipating it'll be greater than 4 weeks. So let's go over the parts of a G-tube. Feeding tubes, drainage tubes, balloons and bumpers. The gastrostomy tube may look complex, but let's break it down piece by piece. So your patient relies on their gastrostomy tube to survive, and if you have already learned 2 new things, consider subscribing and give this video a big thumbs up as it helps the channel tremendously. So let's dive into the parts of a G-tube. So here's your 3-port G-tube. There's 3 different ports on the top. So the first one is your medication port. This is where you're able to administer medication in liquid form, or if you crushed it, if it's appropriate, and you diluted it with sterile water, then you could administer through here. There's 2 different types of syringes and every manufacturer is different. I just want to point this out. So this is a difference. This is a long tip syringe, and then this one is a short tip syringe. So just make differential that there are 2 different types, because they might say, oh, go grab me a 50 or 60 cc syringe that's long tip or short tip. So that's the difference amongst those 2. So this one would be long tip. So if I had to administer medications, then this is the port that I would use. It's so easy to access. It's just super soft. You put it in and then you would inject the medication. The next port is your center one. That is where you are able to administer enteral tube feedings. So it's liquid form. There's so many different gadgets and so many different type of manufacturers, but specific for this one, I've always used a Lopez valve to attach it. And so this is what a Lopez valve looks like. And so this would be inserted this way. And then this would be to off, because I don't want any of the fluid going out here. And then this is where I would attach my tube feeds. So the tube feeding bag looks something like this, the syringe tip. So I would disconnect and then I would connect here, and it's so easy to glide in. And then that's how your medications, this would be set up to a kangaroo pump, and then the tube feeds would administer through here and go in through the tube. So a Lopez valve comes into important play. We use this for helping to flush the line. So this is connected to the tube feeds. If I have to administer medications through the port and I need to stop the enteral tube feeds, I would move this nozzle. So I would stop the actual pump that's infusing the enteral tube feeds. I would disconnect this red port. I would connect my syringe. Then I would move this nozzle to off on this section. I would inject the fluid into here so it can clear the line. And then I would move the nozzle to here, because this isn't infusing anymore, the tube feed. So this would be to off. Then I would disconnect, and then I would apply the port in place. And if I need to disconnect here and just attach it somewhere else, then I can. But that way the line is open and I can administer the medication. The other component to this is the balloon port. So this is specifically a 14 French. And so it says it on here, it says 3 to 5 mils administer. The manufacturer guidelines does recommend 5 mils. And so this is where you would attach a syringe. and you would administer the 5 mils. And so at the bottom of this port, this is where it's going to inflate. And this is kind of like the bumper. So you'll see here, it's inflated up to 5 mils. So if it was a larger French, it would require more. And you want to keep in mind, you want to check the amount of fluid that's in here at least every 7 to 10 days, because the water can kind of upgrade and it can decrease. And so imagine if you see that it's decreasing, then there's no stopper there. And what if the patient's agitated and we haven't checked it? You see how it's decreasing and we're just so busy and we forget. And guess what happens? It gets lodged out, especially for your patient that has dementia, they'll pull it out. So once it's in place, I'm going to reinflate it. Okay, there's 5 cc's, and I'm going to detach, and then you're good. This part is the funnel, and then this is your retention disc. This is what sits on the patient's stomach. It's nice and soft. It's not supposed to irritate the skin, and this is what's going to sit on there. You always want to check for the wound integrity, the skin integrity, make sure there's no granulation tissue forming, any of that stuff. So this part is your tube with graduation. It's in centimeters, so it has 2 centimeters, 4 centimeters, and 6 centimeters. It's just measurement grading. And then here it says 14 French. And then here's your hole in your patient's abdomen is like a window into their digestive system. How a G-tube is placed is through a procedure